are common backyard livestock, but can have many zoonotic diseases. We will first talk about the diseases that you can get from having direct contact with pigs. The first contact disease we're going to talk about is ringworm. Ringworm is a fungus that will cause ring-like rashes on the body and is seen most commonly during winter. And this is spread when you touch the infected areas or objects, such as an unclean hurdle after working animals or by directly touching the animal. Symptoms in humans can include itchy skin, a ring-shaped rash that is red and scaly with cracked skin, and will depend on where someone is infected as to where the rash will appear. You can normally see the rash on pigs, on the neck or around the ears. Treatment for both humans and swine include an antifungal medication. The next disease we're going to talk about is influenza. Swine influenza is most commonly caused by the type A flu virus. Symptoms in humans can include a fever, a cough, a sore throat, a runny nose, body aches, headaches, chills, fatigue. Symptoms for swine can include a barking cough, sneezing, high fever, difficulty breathing, nasal discharge, and going off feed. There are no effective treatments in animals. In humans, effective treatment can include using symptom relief products and to make sure that the person is getting plenty of rest. Next, we will talk about swine diseases that are spread through the fecal-oral route. The first disease we will talk about is Campylobacter. Campylobacter is a bacteria that is common in the gut of both humans and pigs. Symptoms in humans are diarrhea, fever, and abdominal pain. Pigs can be asymptomatic, or they can show signs of fever, mild diarrhea, dehydration, and loss of body condition score. Treatment for both humans and animals can include oral antibiotic medicine. The second disease is Cryptosporidium, also called crypto. This is a parasite that is mostly found in pigs who are recently weaned. Symptoms in humans can include watery diarrhea, abdominal pain, vomiting, and nausea. Pigs can be asymptomatic or can have mild diarrhea. People who are infected should talk to their physician for an anti-diarrheal medication, and animals should be treated with supportive care for symptoms. The next disease is leptospirosis. Lepto is mostly found in temperate or tropical climates. If lepto is passed through urine, it can infect water or soil very easy. It can stay in the water and soil for very long periods of time. Symptoms in humans can include watery diarrhea, high fever, headaches, chills, muscle aches, vomiting, jaundice, red eye, abdominal pain, diarrhea, and a rash. Symptoms in animals can be asymptomatic in non-pregnant animals. Non-pregnant animals can also see signs of mild fever, anorexia, anemia, convulsions, and pigs can fail to grow and gain weight. In pregnant swine, you can see abortions that include mummified fetuses that are carried to full term. Treatment in both humans and animals can include the use of antibiotics. These will be prescribed by your veterinarian or physician. The next two diseases we will talk about are common when thinking about foodborne diseases. But E. coli and Salmonella are common in live animals as well. E. coli is naturally found in the intestines of both humans and pigs. Symptoms in humans can include stomach cramps, diarrhea, and chest pains. Animals may be asymptomatic or showed mild signs of diarrhea. Treatment in humans can include rest and fluids, and to treat animals includes supportive care. The last common disease in swine is Salmonella. This is a bacterial disease that can occur 6 hours to 6 days after the infection. Symptoms for humans can include abdominal cramps and fevers. Swine may be asymptomatic or have diarrhea. Treatment for humans and pigs include antibiotics prescribed by your physician or veterinarian. It is also good practice to do an all-in and all-out farming for pigs. This is where you move pigs all together and never introduce new pigs into groups once they are formed, and that they are all out or moved to a new barn together. Make sure you disinfect all pens before moving in the next group of pigs. You can talk to your local veterinarian to see what vaccines are offered. If you have any questions about specific diseases, reach out to your local extension office and your local veterinarian.